We want to share a modification of the thoracoscopic diaphragmatic ligature reported by Diaz in our last 3 patients. This case is a 4-month-old girl who was diagnosed of diaphragmatic eventracion after a chest X-ray for mild respiratory symptoms. We place the patient in the lateral position across the operating table so the surgeon is behind and the monitor screen is in the front. We'll use a 3mm port just below the tip of the omoplate for a 30-degree optic and a 2mm port placed under vision at the 8 intercostal space. We'll use several spine needles size 20G as several non-absorbable sutures. We use low-pressure gas insufflation to maintain adequate exposure of the diaphragm. We introduce the spine needle from the right to the left, and with the grasper, we pick the diaphragm and insert it through the spine needle. We grab all the diaphragm bit by bit from the right to the left. Once we finish the level, the system from the outside passes the suture through the spine needle and we grab it with the forceps and take it outside through the port. We have to cut the needle of the suture. We take it out the spine needle and with the forceps we grab the other side of the suture and take it out through the port. We perform a slip knot from the outside and press until the plicature at that level is well done. We repeat the procedure several times at different levels of the diaphragm until the whole eventracion is well plicated. As you see, we introduce the spine needle again from the right side, and with the grasper we pick the diaphragm bit by bit and insert it through the spine needle. We perform again a slip knot from the outside until the whole eventracion is well plicated. The technique is easy to perform, reproductive, effective, and the use of a needle will free one port, making possible complete the plicature with just 2 mini ports. The control, the small incisions that don't need sutures, and the patient is ready to be discharged after 36 hours.